My name's Mariah, and I'll be taking care of you today. Let me just sanitize my hands. And then I have provided patient with privacy, and I have checked the doctor orders, which have no results at this time. Can I see your wristband, please? Can you state your full name?
Nicholas Owen Albertson.
Can you state your date of birth?
1198.
Do you know where you're at?
My house.
And do you know why you're here?
For a home health checkup.
Can you stick your tongue out? Can you wiggle your fingers? Thank you. And do you have any allergies or pain?
No.
Patient denies any allergies or pain. Patient is alert and oriented ×3. Glasgow Coma scale was full at 15. Patient's posture is relaxed. Patient's facial expression is relaxed. Patient is dressed appropriate for the situation. Patient's speech was clear and understandable. Patient is well groomed. Yeah. And so the patient has skin color that is pink and fleshy. Their skin is warm and intact. And then, do you have any problems with your head? Have you ever had any injuries, surgeries, illnesses, headaches?
No.
Patient denies any problems with their head region. And then please tell me if you feel any pain. I'm just going to inspect your head. Any pain?
No.
Patient reports tenderness of the head. The head skull shape is normocephalic and round. The hair is brown, medium texture, and evenly distributed. There is no sign of parasitic infections, lesions, masses, or bumps. And then can you take your glasses off for me? I'm just going to check your pulse. Thank you. Temporal arteries are 2+ bilaterally. Yeah, and I'm going to check your skin. Skin turgor is intact, or skin turgor has no tinting, and the skin is intact. I'm just going to feel your temperature. And the temperature feels within a normal range. And then I'm just going to take a look at your eyes. Thank you. Eyebrows and eyelashes are present, symmetrical bilaterally, evenly distributed. There is no scaling, no drainage, no redness, no swelling. And then do you have any eye vision problems?
No.
Do you have any itchiness or redness or pain in your eyes?
No.
When was your last eye exam?
A year ago.
And about what were the results of that?
Good.
And then do you wear contacts?
No.
Patient wears glasses, denies any eye problems. Last eye exam was roughly a year ago with normal results. And then they do not wear contacts or wear glasses. And then, can you look at the tip of my pen, and then at the wall, and then the pen, the wall. And then I want you to just follow my pen light. Thank you. Cranial nerves 3, 4, and 6 are intact by cardinal gaze, which was smooth, steady, with no nystagmus, and there is no ptosis of the eyes. Pupils were symmetrical. Perla was intact because both were reactive. The pupil size at rest was 5 millimeters, and the pupil size when it was constricted was 3 millimeters. And accommodation was there. And then I just want you to hold this about this way and then read what it says for me.
Premium hot tea.
Thank you. Patient's nearsighted vision was intact. So cranial nerve 2 is intact as evidenced by that. And then we're going to go to your face. And then can you close your eyes for me? This is a dull sensation. This is a sharp sensation. I'm going to poke around your face, and I just want you to tell me what you felt.
Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Thank you. Can you puff out your cheeks for me? Can you raise your eyebrows? And then can you clench your jaw and open it and close and open your mouth? Thank you. And close it. Did you feel any pain or tenderness?
No.
So cranial nerve 5 is intact as evidenced by temporomandibular joint with no clicking and ability to have facial sensations. And then cranial nerve 7 is intact as evidenced by ability to puff out cheeks and raise eyebrows. And then next I'm going to take a look at your ears. Do you have any hearing issues, hearing loss, any dizziness, any drainage or pain?
No.
Patient denies any problems or complications with the ears. And then I'm just going to look in them. And then please tell me if you feel any pain or tenderness when I touch your ears.
No. No.
There was no pain when I pulled and pushed on his ears or on the mastoid and tragus processes. And then the ears were symmetrical, no drainage, no redness, no lesions, no scratches or swelling inside. And then I want you to sit that way for me, please. And then close one ear, please. And repeat back to me what I whispered to you.
Car. Red. 7.
And then please plug your other ear.
Dog. Red. 7.
The whisper test was done accurately, and patient is able to hear verbal speaking. And then for your vision, can you sit up straight for me and tell me when you see my fingers? Patient's peripheral vision is intact at the top of the ear and the temporal level. And then I'm going to ask you about your nose. Do you have any nosebleeds, any clogging, drainage,
No.
pain,
No.
itching,
No.
any past injuries or surgeries?
No.
Patient denies any nose complications. And then I'm just going to take a look inside your nose. Thank you. The patient's nose and nostrils are symmetrical. The nose is midline. The nares on the inside are symmetrical. And can you take a deep breath through your nose? And the nose and nares are clear. The nares on the inside were moist, pink. There was no deviated septum. There was no redness, no scaling, no lesions or bumps on the inside of the nose. And then can you close your eyes for me? And then I'm going to have you plug one nostril. And then tell me what you smell, please.
Perfume.
Thank you. And then what do you smell now?
Vinegar.
Thank you. And can you plug the other nose and keep your eyes closed? And what do you smell through this nostril?
Vinegar.
And then this?
Perfume.
Thank you. And you can open your eyes. Cranial nerve 1 is intact as evidenced by the abilities patient to smell perfume and apple cider vinegar through both nostrils. And now I'm going to do your neck. Have you had any past injuries, illnesses, surgeries, lumps, bumps, pain, stiffness in your neck?
No.
All right, thank you. And then I'm just going to touch your lymph nodes, and please tell me if you feel any tenderness. I'm going to start with the preauricle area, postauricle, occipital, tonsillar, submandibular, submental, superficial cervical, post-cervical, and deep cervical. And then I'm going to do the supraclavicular area. No lymph nodes were noted during that, or palpated. No lymph nodes were palpated, and then no tenderness or pain was noted. I'm going to have you face that way, please. And I'm just checking your thyroid, so I'm going to pull the skin back intact. Can you swallow for me? Thank you. The thyroid is symmetrical. Neck and midline is symmetrical. There was no masses, bumps, lesions, or scratching with his thyroid. And was there any tenderness or pain?
No.
And then no tenderness or pain with the thyroid was noted. And then I'm just going to take a listen to your neck. No brutes were noted. And then I'm just going to check your pulse. Carotid pulse was 2+ bilaterally. And then I'm going to inspect your chest area, please. If you could sit up for me. Thank you. And first, I'm just going to take a listen. When I tell you to take a deep breath, will you please? Would you mind lifting your shirt up for me? Thank you. And then, deep breath. 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 Deep breath. Thank you. Lungs were clear in all areas of the chest. Lung sounds were completely clear. No abnormal lung sounds such as wheezes, crackle, or bronchi. And now I'm just going to actually percuss your chest, which means I'm just going to touch it. And then the skin on the chest is also a good color for ethnicity, and it's warm, dry, and intact. And I'm just going to be taking my middle digit finger and tapping right here on 8 of the front chest areas. Thank you. All areas were symmetrical and resonant. No dull sounds heard. And then I'm just going to take a listen to your heart. I'm going to start in the aortic area, and then move to the pulmonic area, and then to the Erb's point, and then to the mitral area, and then to the tricuspid area. Thank you. Heart sounds of S1 and S2 were heard. The heartbeat was a normal and steady rhythm. There were no S3 or S4 heart sounds heard, no abnormal beats, arrhythmias, or murmurs. And then I'm going to inspect your back, please, if you could face that way. Anterior, posterior chest diameter is a ratio of 1 to 2. And then I'm just going to place my hands on your chest, and can you take a deep breath for me? And then lung expansion is symmetrical. And then I'm just going to place my hands on your back again, and when I say repeat, please just say 99. So say 99.
99.
Repeat.
99.
Repeat.
99.
Thank you. Tactile firmitus vibrations were symmetrical, and they dulled or got weaker as I moved down his back. And then I'm just going to listen to your chest. Every time I say breathe, please take a deep breath. Deep breath. 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 And a deep breath. Thank you. All lung sounds were clear in all areas of the lung. No abnormal sounds such as wheezes, rhonchi, or crackles. And now I'm just going to percuss your chest, which means I'm just going to tap on it again. I'm just going to lift your shirt. Is that okay?
Yes.
And I'm going to start up here. Thank you. All areas from percussion were resonant and symmetrical. No dull sounds noted. Thank you. And if you could lay down for me. Next, I'm just going to be inspecting your abdomen. And then I'm going to ask you a few questions first. Do you have any nausea, upset stomach, burning stomach, or problems with vomiting?
No.
Do you have any trouble urinating, holding your urine, burning during your urination, or difficulty going?
No.
Do you have any problems with bowel movements, constipation, hemorrhoids, or pain during movements?
No.
Approximately when was your last bowel movement?
Earlier.
Today?
Yeah.
Thank you. And then in your stool and urine, is there any blood or mucus?
No.
Thank you. Patient denies any gastrointestinal and pelvic problems. And then the last bowel movement was earlier today. And then I'm just going to scoot your shirt up if you can move your hands, please. Thank you. Don't have to do that. I'm going to start by listening to your stomach. And I'm starting in his right lower quadrant, moving to the right upper quadrant, over to the upper left quadrant, and then down to the lower left quadrant. Bowel sounds were heard in all regions of the abdomen. Bowel sounds were normal active. And then I am going to take a listen for any bruits near your arteries. Starting on the aortic artery. No bruits were noted in any region, and so all arteries are normal symmetrically. And then I'm going to percuss, starting in your right lower quadrant, going clockwise around. All areas in the abdomen for percussion sounds were tympanic, symmetrical, no dull sounds. And then please let me know if you feel any pain or tenderness while I palpate. Any pain or tenderness?
No.
Patient denies any pain or tenderness, and then no bulges, masses, lesions, or lumps and swelling were noted. Skin is warm, dry, and looks good for his ethnic color. The bowel and abdomen was soft and non-distended. And thank you. And if I can have you sit up, please. Do you have any issues with muscle pain, fatigue, stiffness, joint pain, or joint stiffness?
No.
Do you feel any numbness or tingling in your hands or your feet?
No.
All right, thank you. Patient has denied any issues with his upper and lower extremities. Can I see your arms, please? Thank you. And your toes. Capillary refill was less than 3 seconds for both fingers and toes. And then, I see your arms one more time. No edema has been noted in the upper or lower extremities, and skin is warm, dry, and intact in both upper and lower extremities. And if I can see your arms one more time, I flip them over. I just want to check your pulse. Radial and brachial pulse are 2+ bilaterally. And then I'm going to check your pulse zone here. And then just your pulse back in. Dorsalis tibius, pedis, and popliteal pulse are 2+ bilaterally. Can you grab my hands, please? Can you pull? Thank you. Can you push? Thank you. And then the same with the feet. Can you push up on my hands? Thank you. And can you pull against them? Thank you. Grip strength in the hands are 5 out of 5 bilaterally, and foot and leg strength are 5 out of 5 bilaterally. And then, can you sit up, please? Can you push against my hands? And can you push against it this way and this way? There is active and full range of motion in the neck. And then can you lay back one more time for me? I'm just going to take my pen light and I'm going to rub it up and over on your feet. Thank you. And then the other foot, just stick it straight up here. Thank you. For the Babinski test, plantar reflex, where the toes have curled downward, occurred. And then if you can keep your eyes closed for me, and then I'm going to show you, this is sharp, this is soft. Tell me what you can feel in and around your feet, please.
Sharp. Sharp. Soft. 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 Sharp. 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 Soft. Soft.
Thank you. And there is sensation in both feet for soft and sharp. Thank you. And could you please stand up for me? And now for this, I want you to take your finger, and without moving your head or anything, touch my finger, and then to your nose. And again. And again. Thank you. Can you close your eyes and put your feet together and just stand still for me? Thank you. You're good. Romberg test has occurred and patient has good balance. Can you please walk to the door and back to the couch? Thank you. Patient's gait is steady and even. There is no ataxia. And then can you just repeat what I do for me? Thank you. Patient has full and active range of motion. And then can you sit one more time for me? And then can you slide your heel down your shin and on the other foot? Heel to shin test was done properly and symmetrically on both sides. And do you know anything about strokes?
No.
Well, I'm going to teach you today. There are some signs and symptoms that can signal that you might be having a stroke, or someone else you might know be having a stroke. If you begin to feel any weakness or fatigue in your arms and body, any drooping of the face or numbness of the face, if you see someone that's having trouble smiling, or even just the eye maybe starting to droop, and then people can get easily confused, and it can be hard to make a sentence or repeat a sentence, and you can notice slurred speech in people. If you notice any of that within yourself or within someone else, it is time to call 911.
Cool.
And thank you for being a patient, and this is over.